gentlemen, thank you very much.
And now we return you to our regular scheduled program in progress.
So if you're a new grad or you're somebody that's in pre-nursing wondering what type of specialty, nursing specialty, that you should go into, let me help you out with that and give you some broad overview information of what each specialty is like and what you should consider about each. Let's talk about it. First specialty, Med-Surg or medical surgical. This is a floor that will provide you with your foundational skills. It will mostly resemble what you have learned in your nursing program. This is mainly considered the bread and butter of nursing because it is where you will be implementing your foundational skills and what you've learned for patients that have mostly chronic illnesses or post-op or pre-op patients. There's just a diverse patient population, mainly adult, that you will be caring for, and the environment it allows you to expand upon your foundational skills and gets you exposure to things that you don't have experience with. So you will strengthen your skills in your foundations of nursing, your assessments, your administration of medications, wound care, critical thinking, time management, and also communication, because you'll be working with the team. On each of these specialties, basically, you'll be working with the team. The benefits for new grads is that there are a lot of residencies out there that will put you on a Med-Surg floor, but also the fact that you will come straight out of nursing school and you have seen these conditions before, so you are already familiar with them, and it prepares you for almost any other specialty that's in the hospital or anything that you could possibly go into. Something that you should consider about a Med-Surg floor is that it is fast-paced. That it can be a fast-paced environment, and it is demanding of your time and energy. It's fast-paced, and you do have high patient loads. Most of your patients are not sedated. The next specialty you might consider is telemetry or cardiac step-down unit. Same thing. In telemetry, you will mainly be dealing with patients that have cardiac conditions, so you'll strengthen your skills in monitoring. You'll know how to read and interpret EKGs, manage cardiac medications, and care for patients that have heart conditions such as heart failure, arrhythmias, or post-cardiac type of procedures in their recovery. For new grads, this allows you to actually become specialized in something, focused on learning more of the details and the functions of the heart and the care that a patient with a cardiac condition should receive. And it's providing you with a good patient ratio for this learning. Some telemetry units have less patients than you would nurse to patient ratio than you would in Med-Surg, some of them. It's a good stepping stone if you want to go to ICU or cardiac ICU, then telemetry is like where you should be to show that you do have some foundational skills in cardiac. It requires you to have a strong understanding of the physiology of the heart and how you should be interpreting the rhythm of the heart. The next specialty is ER. A lot of shows will show you that ER is like the place to be, but rarely does reality reflect what we see on our shows. Sometimes. But what's great about the ER is that it's dynamic. You have an encounter with a diverse range of patients, just like you would in a Med-Surg floor. It's often unpredictable and fast-paced, so if you like that adrenaline rush, ER is for you. You'll see a huge variety of conditions, from minor injuries that people think are major. You'll see some traumas and some medical emergencies as well, what they look like. You will become familiar on detecting those types of things right away. So obviously you'll have to think quick on your feet and prioritize your care. And you have to master a wide range of skills. So the benefits for new grad is this is a great place to start. It's great for developing rapid assessment skills. So you won't be doing a full assessment, but a focused assessment on exactly what the patient says is the problem. If they have chest pain, you're doing an assessment regarding that. You're not, assessing vowel sounds. You need critical thinking. You need to develop your procedural skills. You have to, and also many ERs have dedicated residency types of programs or training programs due to the unique nature of their unit. Some considerations that you might want to think about is that this is a very high stress environment. That's something that the shows got right. It's high stress, it can be chaotic, people are everywhere, staff are everywhere trying to give the best care, and it can be emotionally charged. Sometimes you're also dealing with mental health issues in the ER as well as in Med-Surg. The next specialty is labor and delivery. This is great if you are passionate about mamas and babies, or babies and mamas, or women's health and the whole birthing process. It is an opportunity to have unique and incredibly rewarding and memorable experiences in bringing a life into the world. You'll support mothers and families through the whole process, also through the postpartum unit too, which is connected to L&D. And you'll also provide care to the newborns, as well as to making sure that the mom is recovering okay and that there aren't any post-delivery complications. And again, the benefits for new grads is that there are some residency programs specifically focused on L&D, so check out your local hospital that you intend to apply for if L&D is something that you want to go into. You need to have a distinct skill set, obviously, because this is very specialized, and you need to be able to detect those types of issues that may come upon the baby and the mom. A consideration for this one is that you can have unpredictable hours working in the L&D, and it requires you to have a focused knowledge on OB, obstetrics, and newborn conditions or newborn care. The next specialty is pediatric nursing. So in this one, if you enjoy working with children, this is the specialty for you. It requires a different type of approach to care for children. Things are different. So even medication dosages, the types of medications you can give kids, you need to know how to calculate all of that down to a T, because you can kill a child with one number off, and it has happened, unfortunately. Just keep in mind, it's not just the child you will be interacting with, you will be interacting with the family as well. And you will learn specialized assessments, to do specialized assessment techniques, and how to administer care in a child-friendly manner. So getting them so you may have to have some modifications to your care, like how to take vital signs on a child that's scared. You may have to modify some of that. Some hospitals do offer benefits for new grads. Is that, again, some hospitals offer some specialized training in the pediatric unit, because this is specialized. And again, the consideration is that this can be emotionally charged and challenging, because you'll be sometimes caring for very ill children who won't have a chance to make it. So you have to be able to withstand that. The next specialty is the OR. So this is great if you love surgery and getting into that, and the blood and gore. OR nursing is unique because it is more focused on the procedures, and which are more invasive types of procedures, and you have to understand sterile technique and utilize that. You can work as a scrub nurse assisting with the surgeon directly, or you can be the circulating nurse, which kind of manages the OR and the whole environment and patient care outside the sterile field. Benefits for new grads is that many hospitals, again, have dedicated training programs if you want to go into the OR. They're often called perioperative 101, that training program, which of course it's specifically designed to train you for the OR and those types of procedures if you're a new grad with no experience in the OR. Consideration for this is that you have less direct patient care. Most of your patients, like, they'll be out in a second and then it's just sedation. And then when you are done and the anesthesia is complete and the procedure's done, you're moving them to PACU. Once they're asleep, then that's all of the communication that you will have with them. You can be on call, so just consider that. And last but not least, ICU. ICU, you may, depending on what state that you're in, have that opportunity to be a new grad in the ICU unit. There are different types of ICU units, intensive care units. There's neuro ICU, there is cardiac ICU. So just keep in mind what specialty you want to go into, but most of the time you will need to go to just the general ICU and then transfer over into those more specialized ICUs. I'm not going to say that it can't happen. I think it can happen depending on what state you're in and what hospital you're applying to. They may need nurses. And if you've done a rotation in those ICUs, they may be more open to hiring you, especially if you've been a CNA in those ICUs. In ICUs, you have direct patient care. Most of the time, your patients are sedated, and you run a lot of drips concurrently. So a lot of IV cartridges will be ran into the patient. You'll be dealing with higher critical medications that require more monitoring, vasopressors, things of that nature, more critical and typically dangerous medications that will require more of your attention. You'll be doing total patient care sometimes on these patients that are sedated or unable to care for themselves. So you will be on your feet a lot of the times. Ratio here is about 2-to-1, or it can sometimes be 3-to-1. I did hear of an ICU nurse having 4-to-1, so I'm not sure if that was legal, but it just depends on where you are. Something to consider about this is that you will require some training for this, obviously, as a new grad. But a lot of the residency programs are very aware of that and will walk you through what it is that you need to know as an ICU nurse. So whatever specialty you're going into, it requires strong analytical and attention to detail and prioritization skills to work in an ICU unit. You are studying critical medications and critical care of the patient. You are also the ones that will be called during a code, rapid response, code blue, whatever it is. You are the nurses that will be going, or dedicated nurses, whoever they may assign for that night or that shift, will be going to that code and running it if the doctor's absent, or running it, period. So keep that in mind, that you will need to know those codes. So some of the things that you want to consider when you're looking into these types of specialties is, do they have a residency program or some kind of training program for that specific specialty? You want to know, is the preceptorship strong? Talk to other nurses if you need to about what it is you will be getting yourself into, because you will need guidance to be a strong nurse and to gather the skills that you need to become an effective nurse in these specialties. What is the hospital culture and this type of support that you will be needing? You don't want to be on a unit where there's a lot of bullying going on or some kind of resentment because you're the new nurse. Just seek out hospitals that have been known for giving new grads supportive environments and good staffing ratios, if you can find a hospital that has that. And that they have a commitment to developing you professionally as a nurse, that they have opportunities for you to go over to whatever unit that you might be interested in, maybe to shadow another nurse that's in that specialty, or you've talked to other nurses that started in your unit and now they're in ICU because they opened the door for them and now they're there. Also, get to know yourself. While you're building your foundational skills, assess yourself yearly, a few months in, to find out what it is you're very passionate about in that specialty. Do you want to go into cardiac? Do you like bowel care? Do you like Anything surrounding the colon? What is it that you like? Do you like neuro? Assess yourself and kind of gauge what that would be for you. Ultimately, the best specialty is the one that you decide upon and that fits you. One thing to remember is that no specialty is better than the other. So if you're in ED, or because you have a lot of shows going on surrounding ED, if you're in ICU, just because you're doing critical care does not mean that you are better than any other nurse. We are all a team. And because a nurse is in critical care or ED doesn't mean they know what goes on in Med-Surg or how to take care of a post-op patient. No nurse in each specialty knows everything. So again, just because you're in ED or you're in ICU doesn't mean you know about L&D. Doesn't mean you know how to care for a postpartum mom. So keep that in mind. And just because you're in Med-Surg doesn't mean you know ED or ICU. We are all great in each specialty, and we all need to stay in our lane and know what it is that we can do. So just wanted to throw that out there because I know there's a stigma about that. Oh, you're good because you're an ED or you're a post-op nurse. Keep that in mind. We are all very important, okay? So anyway, I hope you choose the specialty that's right for you. Hopefully you found this video helpful. If you want to know more information about Med-Surg, check this video out right here.